You've touched on some of the things about sarcomas that make it the underdog, so to speak, in the research world. But what are you seeing in the universe of sarcoma pathology that makes you feel perhaps a little more hopeful that sarcomas and the universe of sarcomas might get a little more light in the future?
Right. Well, I can say that while there's not a very active research program in every academic institution, as there would be for other more common tumors, there are really active groups in many places aside from Charlotte. So, obviously the typical places in Boston and MD Anderson, California, places like that. There's really fantastic people working on this. I think that the technology has advanced. I think one of the most hopeful things is the technology has advanced so quickly over my career that back in the day, if you were to say, all right, well, great, you still have biopsy tissue from, a case that was done in 2001, but it doesn't really matter because the material in that biopsy is not going to be useful for any testing. So it really wasn't, there was almost no point in having it. That's not the case at all anymore. The technology exists now really to get high quality DNA and RNA out of these specimens, some of which are really quite old. So we still have the ability to test those tumors, whereas we may not have had that in the past. So that's very helpful. Bone tumors, bone is hard. Obviously, bone is hard. Bone is hard to investigate because what you have to do to process the tumors that arise in bone, it's very harsh to process. The processing is very harsh. So, again, back 5 years ago, 10 years ago, it's oftentimes very difficult to get DNA or RNA out of bone tumors because of what has happened to those tumors from the time that they're excised from the patient to the time they reach the lab for any kind of testing. But again, technology has advanced tremendously there as well. So right now, Nuri, for example, is doing a wonderful job getting DNA and RNA out of bone tumors. So I think those things give us an opportunity to kind of do the same testing that you would do in a lung tumor or a breast tumor that we never had that opportunity before. So I think for me, that's very exciting. I think it's still challenging for sure to get funding to do sarcoma research, and the harsh reality of that is that there's just not a financial incentive for many companies to do that research if ultimately you're going to treat a tumor that maybe 200 patients in the United States are gonna have in any given year. But I think that there's been a positive shift in that as well. I think that pharma has kind of seen the opportunity really across the board. And don't get me wrong, I still don't think that it's sarcoma is primarily what these companies are dying to investigate, but there's opportunities, and in some cases where there may be 100 investigators looking at a lung tumor or a colon tumor, there are still opportunities. There's still talented investigators looking at sarcoma, and I think the pharma is seeing that. And people like Ed Kim is just a truly talented person in helping pharma to understand the opportunity and really the importance of investigating these tumors. So you have to have those people. You have to have the person who's fighting to get attention for these tumor types. Again, it's I keep coming back to it, but there's lots of famous people, lots of prominent people who unfortunately have had breast cancer or lung cancer or colon cancer, pancreatic cancer. So those are sort of out in the forefront. It's, if I were to try to come up with a single celebrity or a single very prominent person who's had a sarcoma, it's very hard to do that. So you just don't get the attention.
Mm-hmm.
But Ed has beat the drum. And really, I can't thank the Paula Takacs Foundation enough for your support. Because really, none of this work, or essentially none of this work, is possible without the funding that you have provided. for our program. And really, again, it's just incredible. It's just an incredible coincidence because this just doesn't really happen. Like I've been in other places and other centers, and it's, you know, it's extremely rare that you have this coordination where you have the support of the community, you have investigators here in the hospital. So, you know, we would still be on the ground floor without the Takacs Foundation support. Can't thank you enough.
Thank you for saying that. You know, I've gotten to know so many of our supporters, and I can assure you that the passion and the dedication of these people to make someone's life better is like nothing I've ever seen. And you know, even for these families that have lost their loved ones, they are still so passionate about making the next outcome better for the next person and the next family, so that no one has to ever go through what they went through. And
I'm really struck by the turnout at the Takacs Foundation events, whether it's the Sarcoma Stomp or really any of the events. It's very moving to talk to family members, like you say, frequently people who have lost their loved one, but they're there, they're present, and they're still very active in the fight. They haven't given up. So for me, that's very moving, and really that's the encouragement that I think we need to keep working on this no matter what. It's very frustrating. I was wondering if you were going to ask me if I'm very excited about all the discoveries we've made, and the discoveries are very hard to come by, and you know, the progress is in short bursts. But you know, again, the foundation events they really drive home that you definitely can give up. It's definitely a fight worth fighting.